I'm a faculty member in the College of Public Health. I'm an instructor too, and I teach all of our disaster and humanitarian relief courses within the college for undergraduate
Amazing.
students. Sorry.
And no, it's okay, totally. And what do those classes entail?
So for undergraduate students, they're kind of entering the field and looking at how they can be future emergency management. Um, I don't know, personnel, whether it be in an office of emergency management or working in a hospital system or working at an airport or any other kind of critical infrastructure and thinking about how they would manage and plan for different types of emergencies. So we have people from all across the state, from all across the country on different levels and scales of where they typically work.
That's incredible. What is the link between public health and emergency management?
So from our lens, we're always kind of thinking about populations, right? How can we better serve or better protect or better prepare populations for potential threats? So that could be something from, making sure that a facility is prepared that might have to provide essential services to the residents of a community that's been affected by a hurricane, all the way to making sure we're thinking about family reunification after a mass casualty incident, or making sure that our airports are ready for a potential, mass casualty incident. So a lot of it could be, catastrophic events all the way to making sure that just we're thinking about populations that might be affected and trying to prevent injury or death from even occurring.
Hmm. Have you seen this field change over the course of the years as you've been teaching? Like, have you seen priorities shift in terms of the industry?
Yeah, so every year things are constantly changing. I have to keep up with, what's going on in general, as well as a lot of our practitioners have to stay in the loop in terms of regulations and procedures and proper planning techniques, best practices, lessons learned. With each storm, with each major disaster that occurs, we're constantly thinking about how can we do better? How can we learn from those that were on the front lines in these major events, so that we're not making the same mistakes if something were to affect our communities in the process. So for us, technology coming out, looking at AI and the use of different types of tools that we can use is huge. We use something in emergency management called Web EOC, and that allows us to better communicate and coordinate in these efforts. So there's a lot of add-ons and tools that you can always add to some of these platforms to either provide you with better situational awareness or working with different or across sectors so that we have the right information that we need to be able to make the calculated and timely decisions that we have to make in the field of emergency management.
Well, I'm really glad you brought up lessons learned because that's one of the questions that I had for you. I covered, the impact of Hurricane Helene and Hurricane Milton last year on, the state of Florida, North Carolina. I'm curious, what lessons specifically do you think that emergency managers took away from those two storms?
Well, I'm here in Tampa, Florida. So we in the Tampa Bay area are a coastal community that initially we got hit by Hurricane Helene, and then only 8 days later we were prepping for Hurricane Milton, which was actually heading straight for us here in the Tampa Bay area. So for us, the back-to-back storms in August, we had also Hurricane Debbie. So we were pretty exhausted from that one, only for, a couple weeks to turn around and then preparing for Hurricane Helene. So for us, those three storms really showcase that we need to be prepared because storm systems are becoming stronger. They're, developing to a point where even if they're off the coast of, Florida, they can have detrimental impacts to our coastal communities. So that was probably one of the biggest realities, especially from a resident's viewpoint, is even when emergency management is issuing those orders for evacuation, that if you're in a coastal area and you're told to evacuate because you're in evacuation zone A or B, that it's important that you follow and heed those warnings, because even if a storm is over 100 miles off the coast of Florida, it could still create storm surge. And that's what we really saw with Hurricane Helene here in the state of Florida. Even though a lot of people were hesitant We actually had a large number of individuals that didn't evacuate because they thought, oh, it's so far off the coast. I actually do research and evacuation studies, and that's what we're seeing from a lot of coastal areas in the state of Florida that weren't going to get that direct hit like the Panhandle got, right? Or, even when we were listening to individuals in the state of North Carolina, South Carolina, Tennessee, Georgia, a lot of those individuals never anticipated preparing for a hurricane as if they were a coastal state. They're so far inland that they thought, okay, we might get rains, we might get flooding, but the impacts that we saw with Hurricane Helene, even on the core of our country, in that those inland cities, was pretty detrimental to maybe think about preparedness a little bit differently when it comes to evacuations, having plans, communications, making sure that you're just prepared for hurricane season, even if you don't think that you're in a potential area that could be threatened. Another thing is just how those cascading events could impact our water systems and sewage systems. Here we had a lot of pumps fail, unfortunately. So we had areas that were flooding that weren't in a flood zone, that were very unprecedented. We don't normally or even anticipate flooding to occur, where these communities had water for a month, 2 months before the water went down. So the water was just sitting there for weeks and weeks and weeks until we can pump it out and then put it somewhere else. That's how bad it was. So for us, that was kind of in terms of making sure we had those redundancies in our energy systems, making sure that if we do have pumps set up, that those pumps are, can switch over to a generator, where we're not having to worry about sewage backflows and other things like that. And the other thing is we actually, not so much with Hurricane Helene, we had some electrical power outages, but our power grid was really affected by Hurricane Milton. And so Hurricane Milton actually took out majority of our electrical systems within the Tampa Bay area. So people were mostly without power for 5 days to 2 weeks. And so for us, that was like a big thing.
I have so many follow-up questions to everything that you just said. First off, I want to talk about the unexpected nature of the hurricanes that affected residents so far inland that would not think of preparing themselves as if they were in a coastal community. How do you change that mindset or how does the government possibly change that mindset? What can state and local officials do? Is it media campaigns? Is it education through schools or community programming? How do you shift the mindset that when an alert comes in, whether it's in a coastal community where the hurricane is far off the coast or a little bit further inland where they think the alert might be exaggerated? How do you shift the mindset of, I need to trust this information that I'm receiving and I need to take it seriously?
Yeah, so for us, we saw that a lot of our coastal areas that had mobile homes, we have a large mobile home population. Um, and so that was a big one for us, just our mobile home residents. A lot of them do not want to evacuate, or they don't realize that if they're in a mobile home, it doesn't matter if they're in evacuation zone A or not, because they still need to evacuate regardless, right? Because the wind speeds. Another thing is shifting the gear from, or the messaging or the language from focusing on the category of the storm. That is a big thing that people tend to focus on is, oh, it's
Mm-hmm.
only a category 1. I'm not worried about it. It's not a big deal. I've seen worse, or, I'm not going to worry until it's a category 4 or category 5. You got a lot of people that have that mindset. And wind is something, yes, that we have to worry about. And usually it comes with other hazards that kind of are a rippling effect. The biggest thing is storm surge, though, water. So the power of water and making sure that the narrative is focused on and like multiple hazards, not just wind, because wind you can go into a structure that's pretty sound and you're fine, right? You hide from the wind, and you run from the water, right? That is the messaging that we want to reiterate, and that's really big in terms of making sure that we reinforce that messaging and that knowledge, because most of the deaths that we typically see are related to drowning or are related to that storm surge or that threat of flooding. So I think that needs to kind of shift gears. I mean, even when you think about it, I was in New York during Superstorm Sandy. New York was devastated by flooding. They were devastated by that storm surge that hit Staten Island, Long Island. Like a lot of those areas were completely devastated. And then on top of it, we had fires that were occurring in some of these residents because of the battery packs or water or all this stuff that was kind of in their garages catching fire. So then you're dealing with multiple hazards at one time, right? So that was something that I think, even when you look at the number of deaths or the impacts, that was pretty detrimental because a lot of people don't realize that wasn't even a tropical storm when it hit New York in New Jersey. Hurricane Katrina, it was a category 5 leading up to the Gulf area, but it actually was only a category 3 when it hit New Orleans, right? And so a lot of that was fail points within the levee systems and water, again, flooding. So I think a lot of people don't realize if you live near a retention pond or if you live in an area that normally floods when there's rain, you could either be trapped in your neighborhood, you could experience unprecedented flooding and rain because of the rain event. You could have other effects than that wind speed. So that's another thing when we're talking about messaging and communication. When you're sending out notifications that people are not only receiving them, but they also know what to do with that messaging. I think that's something that's reiterated that they might get mass texts from the county or from the state saying, hey, warning, tornado watch or flood watch. But what do you do even with that notification? And then on top of it, making sure that people are getting that information on time. So we can even see in Texas, the flooding that occurred in Texas, that was a reoccurring question. Like we didn't have in one city, they had notification systems and sirens that helped warn about that messaging. They didn't have it in other cities that had devastating effects in terms of number of deaths, right? And you could tell a huge difference between one city that had that system in place versus the other, right? So that's something that maybe we need to have in place in some, especially in some of these mountain um, towns of, you know, uh, Tennessee, North Carolina, South Carolina, Georgia, that do have that unprecedented flooding in their riverways and their inland flooding. Another thing is even in here, I mean, throughout the state of Florida, we constantly talk about the cresting of lake or rivers after the hurricane has passed. So as the hurricane is slowly making its way up to Georgia or, up to either more of that inland area, all of that water is going to go up north. It has to make its way down through our river systems. So 8 to 10 days later, that's when we'll start seeing our rivers start cresting in the state of Florida. And that is across the state because it's making its way down. So that's something that a lot of people don't realize happens. They're like, okay, the hurricane's passed, let's start cleaning up, let's start moving forward. But if you're not aware, especially we have a lot of new residents moving to the state of Florida, our population is increasing. We're getting a lot of people from California, from Chicago, New York, from all over the country moving here, either for retirement or for job opportunities and growth. And this is something that, those new residents are just maybe not aware of or have the knowledge in regards to preparedness. So from that lens, we are always constantly thinking outside the box. How do we make sure that our people visiting the state, because we have a large number of tourists coming here, all the way to those new residents, are retirees that are maybe used to winter storms, but they've never, really experienced a storm system to that caliber or size, right? But now they're living in a coastal area or they're now living on a riverway or waterway. So each household is different. Each preparedness measure is going to be different based on your needs or your family needs. And it's going to be based on the risks for your, where you're located. So we constantly have to think about or explain to individuals that my family plan may look a little different from my neighbors or from somebody that lives, only a half a mile away, just on, do I have a retention pond? Do I have a system in my community that is going to have those redundancies in terms of power grid and electricity versus, pump stations and, retention ponds and things like that.
Yeah, I'm so glad you brought up like the categories of storms and hurricanes and how that can affect someone's mindset in terms of the severity of the storm and what to expect and weigh that against possibly evacuating because that's exactly what happened as I was reading and researching with Hurricane Erin this week, where off the coast in the Atlantic, it had developed very, very quickly and
Yeah.
intensified as a Category 5 hurricane, which is one of the strongest ever recorded in the Atlantic. But it quickly, like just as quickly almost as it like intensified, it downgraded before it hit the coast into a tropical storm.
Yeah.
I'm curious is because like these alerts and warnings and communication systems, uh, hurricanes are unique in that they have an extended lead time that other natural disasters don't. Like
Right.
tornadoes, it's roughly 20 to 30 minutes. Flash flooding, it can be within maybe an hour. And same thing with like wildfires, you can have an extended amount of time for hurricanes and hurricane preparedness. What are officials doing within that window of when a hurricane alert goes out? Are they erecting barriers? Are they, going through communities and making sure people know to evacuate? What is the window of time that people are doing, like community and emergency management officials, to prepare for communities to be hit by a storm?
Yeah. So I think you make a good point. I always tell people that even though I'm dealing with hurricanes here in the state of Florida, I think it's better than wildfires or earthquakes, or I couldn't imagine, having to do to the scale of what we do in a community that has, very little time to mobilize. So we actually like to pre-position as much as we can ahead of time, making sure that we're thinking through like what populations or areas of our county are most vulnerable, so that messaging is getting out to them. We have to coordinate for us in the state of Florida. Not all states are like this, but we have what's called the special needs registry. So those are individuals that are not quite to the point where they need to be in a hospital, but they do have like a caregiver, or they do need to be, they're reliant on some sort of like energy source in terms of electricity dependency, or refrigerated medications, or something that would not be ideal to send to them to a general population shelter, right? So we have to coordinate with those individuals, even here in the state of or in the county of Hillsborough County. We have over, 1,400 people on that registry for our county, which means we have to contact each of those. We have to coordinate transportation to get them to the special needs shelter. They may be in a hospital bed in their home on dialysis. So making sure that they have their equipment, and you're transporting them using an ambulance because you can't put them in a traditional vehicle. Like those are the things you have to prepare for and kind of get going so that they're out of harm's way. Also thinking about making sure our hospitals are set up. So here in Tampa, our Tampa General Hospital actually started doing these floodgates or flood barriers fully around their hospital system. And it allows them to have at least 10 feet of potential storm surge without impacts to the hospital. Because evacuating a hospital is extremely difficult. So we have quite a few hospitals here in the state of Florida that are directly on the water. I don't know what they were thinking when they built them. But especially like Tampa General Hospital, the last time we got hit by a direct hurricane with detrimental effects was in 1921. They built that hospital on an island in the heart of downtown Tampa with potential 20 to 30-foot storm surge. I don't know if you can even imagine what that would look like um, in 1926. So you're sitting here going, only 5 years after being hit by a major hurricane, you thought, oh, let's go ahead and build a hospital here. But they've been working really hard, making sure that their generators are on the fourth floor, making sure that they actually installed doors in the bottom level that are typically in, a naval ship, with the locks where you can make sure water doesn't get into their fuel systems.
Mhm.
They've put things into place to try and make sure that they can shelter in place for extended amount of time. Last hurricane season, we really got to see that wall in action. It actually went I think it went pretty viral. The wall that was around the hospital, there was a gentleman standing on one side of the wall, and you could see on the other, the water is way above his head, right at the very top, almost at 10 feet. So, and they put that barrier all the way around the hospital, which is pretty amazing. So, I've been to a couple conferences and sessions where they've asked me if they find out about Tampa. They ask me about the wall and the flood wall, in terms of being able to protect the hospital. They've been talking about, sharing with other hospitals or other entities how they can maybe use some of these types of tools to better prepare their facilities. These are just some of the things, like as things are rolling out or as things are developing, or we're looking at innovative ways to do things better. This is a great way for us to say, okay, what is the industry standard? What kind of works? What can we test out? Where can we do better in terms of pre-positioning and preparing ourselves for those types of events, so that we can have either make it so that people are protected and they're not, we're not having that high level of loss, or making sure that we're deterring that economic impact on our communities as much as possible. So, I don't know if
Absolutely.
you're familiar. They say, for every dollar spent on mitigation, it's $6 saved. So that's something that we're constantly trying to reiterate, and making sure that we're allocating those funds and that money to being better prepared for that next
Mm.
potential event.
Yeah, what I'm hearing is that there's a concentration on building a little bit more resilience into critical infrastructure. Like you're mentioning the electrical grid, like healthcare systems,
Yeah.
residential areas, roadways. It sounds like the state of Florida and state and local officials are kind of leading the way, especially these coastal communities. That, I mean, this is an annual thing. Hurricane season is. And storms are only intensifying as climate change gets worse. I'm curious, how or have the the staffing cuts at the federal level to the National Weather Service or NOAA, have they impacted any of the data alert times? Have they impacted any of the resources that state and local officials in Florida rely on when preparing for some of these disasters?
I mean, for us, we haven't had, oh gosh, I almost don't want to say this out loud, right? We haven't been
Let's not jinx
a lot of
it.
but that question has come up, like making sure, when I talk to people in our community that work in emergency management, or that rely on the weather service to give that timely, accurate data, a lot of their decisions rely on that information. So they work very close. Emergency managers work very closely with the weather service, with NOAA, with their teams to go through the timeline of what it takes to evacuate. So, for example, each county has projected evacuation hours, like number it takes to get people out of their area or out of harm's way. They have a system in place where they will give a certain amount of lead time, certain amount of information to the public on where to go at those time increments, so that they know what is the latest possible time that you have based on the most recent update to get out of your home if you need to evacuate. People tend to wait to the very last minute to evacuate, unfortunately. And so we want to make sure that we're giving them the information they need, so that they're not in a really bad position where they can't leave. That was a lesson learned, especially from like Hurricane Katrina. A lot of that messaging was way too late, and people did not have enough time to get out, right? Even though those evacuation orders were issued, or they did recommend people to leave. Same thing with Hurricane Ian in 2022. Some people waited way too long thinking, oh, is it really going to, where is it going to land? Where is it going to hit? And then all of a sudden it cut over and hit Fort Myers. In a lot of the modeling that we were seeing early on, a lot of people thought that it was going to be a little bit further north towards, the Tampa Bay area, that it was going to make landfall. So that's the thing, is we need that timely information, because if it starts to shift just a little bit, or we start to see changes in the wind direction, or we start to see any kind of shift or change, that can literally change the projection of our planning and our response. And if our residents are ready or can be ready, because you can't instantly turn things on and it can't just instantly happen. So when you're doing those types of evacuations, it could take hours to get people out. And then also just making sure you have fuel and making sure people aren't trapped. That's actually when we do evacuation research, I can tell you that that is the number one issue of concern is people being trapped in or stuck in traffic, that they choose not to evacuate because they don't want to sit in traffic for 24 or 48 hours because they've had maybe bad experiences in the past. So making sure that everything's timely, they've been trying over the years to perfect that. Making sure that people are, there's like a staggered evacuation response so that they're evacuating people closest to the coast first, giving people to kind of time to position themselves, and then moving on to evacuation zone B or maybe even evacuation zone C. So making sure that that staggering happens with time increments. They've looked at also, they've done modeling and studies using like technology to kind of look at ways in which we can better evacuate. So each of those things kind of plays a role in terms of how we position ourselves to make sure that everybody's going to be safe, everybody can get out, and making sure that people understand that message in terms of making a calculated decision for their family and whether they should stay or go. They rely on that messaging and that data to make that decision. And if we see those messages come too late or we see shifts or changes not so in a timely manner, that's going to really hinder our ability to make sure that people are prepared for the worst.